My name is Connie. I've been a patient about 5 years, and my son Eric has also been a patient about 5 years. I was looking for a new dentist. I had been with a dentist about 25 to 30 years, and he had some health issues and he retired. And I was primarily looking for a dentist that had a lot of hours as far as evening, Saturdays, that type of thing, because I was working full time at that time. I have a lot of crowns, not because I didn't take care of my teeth, but because they're just the weak part of my body, I guess you'll say. And so I have a lot of crowns, I have a bridge, and I have 3 implants. My son is a special needs person. He's developmentally disabled, and he functions at about age 7, okay? And we were hit or miss as far as his cooperation in dental offices. Sometimes he'd go in and he'd be okay, other times he wouldn't cooperate, that type of thing. So it was important for me to find some place that treated him just like you or I would be treated, and actually they probably treat him, I don't want to say better, but they're always enthused when he comes in, and therefore he's enthused to be here. So it was really important for me to find somebody that would be friendly and work with him and understand that sometimes they're not going to get him to open his mouth right at the beginning, although he's pretty good about it now. I mean, we get a lot of work done, and he's in the process of getting about his 8th crown. I think in the start it was a little bit more difficult because he is not a person that does well with change, and it was new coming here. One thing he was excited about, the giraffes that are outside. He thinks that's really cool. But the way the gals just kind of made over him and made him feel comfortable and stuff, it wasn't very, very long at all before. I mean, he was just in the door, bolting in the door, and hi, and announcing his name, and and just feeling that he had a place here to come and get his dental work done. The way I plan my financial care is I set money aside, knowing that there has to be yearly cleanings, every 6-month cleanings and checkups, that type of thing. I've always been very astute at that. My parents trained me very young that your dental care is really tied to your medical well-being. So that's always been an important part. I had braces as a kid, that all that stuff, and so my parents always kept my dental work up, so they made that an important part of my upbringing, I'll put it that way. So I've set money aside for that, and obviously, there's emergencies that'll come up, and so I have some savings, and if it's been a big amount of dollars for something, let's just say I had to have a crown and Eric had to have a crown at the same time, the dental office has worked with me a little bit on making a couple of payments out of it, that type of thing. This year I also took advantage of their boom cloud, which is exceptional. Okay, it's a $450 charge, and it covers the cleanings and the x-rays for 2 visits during the year, and it gives you a deep discount on other services. So that's been a really good thing, and that is for people that don't have insurance. So that came as a welcome addition to my dental financial plans. So this year they put in like a membership program, and it's a one-time fee yearly, includes 2 cleanings and the x-rays and various things that you would have done, and a pretty deep discount on other services that you might need going forward. So that's been a big plus to my financial abilities, and greatly appreciated that something like that's available for people that do not have dental